Hi everyone, my name is Rutvi Pota, and today I will be presenting on biomedical engineering research in developing countries and why it is important to promote. So just a little bit about me. I'm a rising junior at Lindbergh High School in San Jose, California. I'm interested in exploring the applications of biomedical engineering and research. And for some of my extracurriculars, I'm the co-president of Hands on STEM, which is a nonprofit organization that aims to close the education gap by providing free STEM workshops to underserved communities. And I'm also an officer of my school's engineering club. I am the outreach lead for Wave Learning Festival, which is an organization that also aims to lessen education inequity internationally. I'm also the co-president of my school's French club. I do Indian classical dance, and I sing as part of my school's choir. So just to define biomedical engineering, it is the intersection of biology, medicine, and engineering disciplines. So that would include tissue engineering, medical device engineering, among many others. But specifically, biomedical engineering research places a focus on healthcare. So that means researching different diseases and coming up with treatment and prevention solutions. Now, where it connects with global health comes in with the Sustainable Development Goals, which are 17 goals adopted by the United Nations with the goal to protect the planet and poverty and promote peace. And so specifically, these efforts should ensure healthy lives and promote well-being for all. Now, global health comes in with the engineering research aspect because engineering research improves global health equity, and economic development through innovative technology and improving engineering education in underdeveloped areas, as well as supporting a knowledgeable local engineering workforce in low-income countries. However, this also comes with its challenges, which I will talk about further. Now, according to the National Center for Biotechnology Information, the world's majority, so about 85%, the population is from low middle income countries. And the burden of communicable diseases and these disorders is about 13 times higher in low and middle income countries than that of high income countries. And now I will talk further about why promoting the research for engineering is difficult in developing countries. So higher education is very important in order to publish credible information for generations and generations of engineers. However, the issue is that there is a large dependent capacity in developing countries because a majority of the research is carried out by developed countries that may not address the needs of a local population in third world countries. To bring up some specific statistics, again from the National Center for Biotechnology Information, about only 2% of scientific publications in index journals come from developing countries. African researchers only produced about 2% of all global publications in 2009, and in 90% of the health problems impacting the poor, only about 10% of the global spending on health research development is used for research, which is referred to as the 10/90 effect. It is important to consider that we have made meaningful progress over the years. So for example, from 1999 to 2012, the enrollment in sub-Saharan Africa increased from 2.3 million to 6.3 million, which is about an improvement of 4 million people. Science and technology research, as I mentioned earlier, is prominently carried out and produced by developed countries. And so this may ignore the local factors, cultures, and needs for these developing countries. And in these countries, there are poorly maintained facilities and a lack of research materials or equipment many of the times. And because the professionals are underpaid, they are unmotivated to teach to the best of their ability. So this depicts from 2002 to 2007 the gross domestic spending on research and development, and it shows that in Africa it stays stagnant at about 0.9%, so no improvement, and even in the other third world countries, it starts off at a small percentage and only increases by a small percentage. And so when more students enter a university, so more students are going in and trying to break the cycle of a lack of the local or limited local capacity. But the problem comes in because faculty workloads are increasing. More part-time professors are hired to teach at these reduced costs, so they're being underpaid. And so that means that there's also a lack of engagement in the faculty, which reduces the quality of the research or the teaching that is happening at these institutions. And so I'll read a few of the key statistics from this slide. So according to Duke in 2017, about 68% of sub-Saharan African countries have only one or less biomedical engineers per 1 million people, and about fewer than 15% of Africa's countries have professional engineering institutions, according to the WFEO in 2014. So I talk a lot about these challenges. Now, how can these obstacles be overcome? So it's really important for diverse solutions to be created to have a diverse workforce, and that means diversity in education. So that means all races, genders, and ages. It's important to consider that this can come through international partnerships, which I will talk about later on, and to note that global health programs generally attract more women and foreign students. So a generally underrepresented population in STEM, and that is brought through by this interdisciplinary research. This is an example of scientists at a laboratory in Cape Town, South Africa, and promoting diversity in research. Specifically now, international partnerships benefit greatly developing countries because they encourage underserved communities to pursue STEM careers, as I talked about earlier. More opportunities are provided via specialized training resources, and there is a greater access to instructors and researchers from both institutions to open up more opportunities and they're better equipped to serve their local community. Now, it also greatly benefits developed countries because they are able to come up with creative and resourceful approaches to innovation. So that means with a limited budget or a different need for a different population. And they are able to gain a deeper understanding of global health applications in a real-world context. And this is an example of an international partnership between Oxford University and the Indian Institute of Science in Bangalore, where they created the Pura Grasp Affordable and Safe prosthetic. The design was created in India, and the clinical trials and commercialization happened at Oxford. Another example is Rice University and the University of Malawi Polytechnic, where they created the bubble CPAP device, which increased the survival of these newborns by 27%, and the devices were 15 times less costly, so a lot more affordable than previous CPAP devices. So the success was coming in by the collaboration of these universities. So what's next? Of course, it's really important to ensure that international university partnerships are being created for these diverse solutions, as well as diversifying the actual education. But there's a lot that we can do. For example, me as a high school student, although I might not be able to help in some of these other ways, I can volunteer for nonprofit organizations such as Hands on STEM that support STEM education in underprivileged communities. And it's also really impactful if you just raise awareness, which means stay educated and share any information with your family and friends. to, even increase funding in some of these countries to support the research. These are the references that I used today. And thank you so much to everyone for listening, as well as the GHLC at Johns Hopkins University team and my family for supporting me.